even for fun's sake, don't go into smoking habit. Smoking and drug abuse is have to be removed totally. Then, once in a while, get screened. Then you will know where you are. Next one. Then, when you are treating the cancer, these are the different types. You have the surgery. Surgery should be your last option. Don't go to surgery jumping at it. Surgery is risky. Then, meanwhile, try other things. Chemotherapy, radiation, bone marrow transplant, immunotherapy. All these are available today and go step by step. Not that you know a surgeon who is your friend and he says, come and let us have surgery. Don't be tempted. Particularly, I am worried about the prostate cancer patients. I never saw anybody surviving after the surgery. Very few. Then cancer treatment methods. Nowadays, people are also looking at herbal. Our food plays a very major role. We are forgetting about that. We are using bitter leaves. We are using dogoyaro. All this kind of thing, herbal things, what our grandmothers and grandfathers are using in the past, they have a meaning in it, and let us try to look at them more seriously. Some of them have curative effects. It will not be toxic. Even if you take more, it doesn't affect you. So that is where now you need to be very careful and choosy. Take as much as possible natural, biodegradable, and which are herbal based. Then another statement is coming from stem cells. Stem cells are from the bone marrow. There is a wonderful substance. You can take it to transplant it, and you can produce your red blood cells, white blood cells, platelets. All this can be produced from bone marrow. So that treatment is coming and becoming more, and people are looking at it. Then you have the auto transplant, you have the allo transplant. These are some of the things people are using. But still in the developing countries, you have very few options. We have not reached that stage. How much money you need to spend if you want to go for all these outside treatments. Then Nigeria, cancer with the highest 5-year relative survival. These are some of the jargon we are using in explaining how do you describe cancer, how do you assess, or how do you record some of these things are there. So you can use these, or when you read some of these things, keep in mind these are the ways of quantifying the cancer. These are the ways you can make the elite to understand what it is. Okay? Then you have the 11 registries. We need more. And we need more field work, not anymore lab-based. Then regional data cancer history and epidemiology workshop. We have some figures are available, and these are all useful in planning. Then we made a study on the comparison of Port Harcourt and Ibadan. Port Harcourt, because it's highly industrialized, more of organic pollutants coming from petroleum operations. And we find that there are more cancers in Port Harcourt than Ibadan. You can see that people who are living, who are exposed to that, and also technological innovation. Over a period of time, next slide, yes, see that every decade you when you analyze, you see the newer technologies are coming. We are able to understand better, and we can also treat better. So this kind of trend is very scientifically. Now we have to apply this kind of trend in our day-to-day life. That is where now developing countries must reach the developed stage. We cannot be dependent on America or Europe. And this kind of migrating to other countries for treatment, it has to stop. Now, from our own side, from an environmental point of view, now what we need to do is manage your environment properly. You recycle as much as possible. You treat your waste. You safeguard your environment when you are disposing it out. Then we also developed what we call Renewable Resources Center in Ibadan. Under that umbrella, we have 25 technologies we have put up, what you can do with your waste, and we can provide the technologies to anybody who is interested when it is available. You can see that last year it was commissioned by the Tech Fund, and you can see a lot of the next please. Next, yeah, this is the organic fertilizer from waste. Next, this is where Renewable Resources Center. On the right, you find so many technologies like biogas, biofuel, so many types like that. So So these are available. Don't have to import from outside. This is where we are now telling people, look inward, develop your own technologies, encourage them and get them. So environmental management and occupational hygiene and hazard prevention will reduce the risk of cancer and increase life expectancy. Thank you.
Let's do it one more time. Prof, we're very grateful to you. You will agree with me that Professor Sridhar has done a lot of justice to the topic, major agents of environmental and occupational cancers in Nigeria. To me, he has presented a rather grim picture. There are pollutants, chemicals everywhere. There seems to be no hiding place from e-waste, cosmetics, heavy metals, consumption of fish, whatever you can think about. We are exposed to these pollutants and chemicals. But when it comes to cancer, the key thing is prevention. The doctors also talk about early detection and treatment. But you will agree with me that prevention is always better than cure. And I hope that we can all find a way of living our lives in such a manner that we can avoid this terrible, terrible disease. I'm sure we have things on our mind, questions, contributions. So within a very short time, the next 10 minutes, we are going to take questions and contributions. Please, can you put up your hand if you have a question or a contribution? Along the line, okay, I can see 2 hands. Any other person? 3. Okay, very good. Let's start with the man at the back with a very heavy face mask. So you will tell us your name, where you have come from, and then you will ask your questions or make your contributions. Please come up stage.
My name is Famu Bode Timitope. I am an environmental health practitioner. I work in Obafemi Awolowo University Teaching Hospital, Ile-Ife. I want to appreciate that comprehensive lecture, Prof. But my question is based on the incinerator. One of your slides, he talked about incineration of waste. And in that slide, you said anytime we incinerate a waste that contains PVC, polyvinyl chloride, that it emits dioxins and furans. And in my place of work, we burn waste with incinerator, but specifically, we based our incineration on the shafts. And anytime we burn, we observe that the smoke is environmental friendly. What do I mean by this? There was a time that we invited some chemical engineers. They've taken samples to the lab, and they said this smoke is environmental friendly. So it's like it's negating what we are having in our place of work. So if we have any other method that is more safer than incineration, I'll be glad to hear. Thank you, sir.
Okay, I think we will take all the questions at once and then you can respond to them. There's somebody there. Yes, please come.
Thank you. Like my brother, I'm also Olabode, but I'm a motor show. Thank you, Professor, for the wonderful presentation. I'm from University of Ibadan. And I have two major questions. The first one has to deal with X-ray. You know, you made mention of like exposure to X-ray, which we know exposure to radiation, can lead to cancer. But I think we have to be careful when we mention radiation, because most times when we go for tests, you go to hotel, you have to go to airport, you are exposed to X-ray. But I think we need to, like most of my brothers and sisters in secondary, they have to know that most of this exposure to radiation is in a very low level and it is safe for their health. So I just want to create a balance between that there are some radiation that is safe, like the sunlight, but we have some people that when they expose to sunlight, because of the melanin, because of the skin exposure, they can be exposed to cancer. That's my first point, that we have to create a balance between that. But the major thing, my major concern is when you made mention of tobacco and cigarette. Most times I watch Bollywood, that's Indian movie. And before they start the movie, you will see an advert, don't smoke. But we see, and even on cigarette, you see smokers are liable to die young. But we still see people smoking every day. I don't know, maybe there are benefits that cigarettes give to people, or tobacco, that's why all this warning, people are still smoking. So if smoking is actually very bad, if cigarette and tobacco is very bad, then I think like we have our environmentalists here, they should do something about this menace in the public. Thank you.
Thank you, Mr. Olabode. I can see more hands now. Dr. Ogini.
Thank you very much, Prof. I think I got scared after this presentation. You know, Boli, the banana, that plantain, roasted plantain. We like to eat Boli very much. And the agbado susun, roasted maize. And then the suya, you know, meat with smoke. And then this barbecue fish with aluminum wrappings, which is sold almost in every street corner now. And then the bottled water. Most of the time, this bottled water, they're left in a plastic in the sun for a long time, sometimes for months before we buy them. And then we buy them, and then we consume them. Now, I'm getting so scared. I don't know what to do about this. What are the options that we have? So that, because these are things that are common, you know, in our day-to-day living. And then, of course, with all this knowledge of carcinogens in them, what do we do? How do we, you know, live safely?
That's why I said there seems to be no hiding place.
Thank you very much. My name is Pharmacist Sumono Olasokami. I'm a pharmacist. And from Osun Health Insurance Scheme, my boss has said some things that I wanted to say. But those ones are voluntary. You either go and buy Boli by yourself, you buy smoked fish by yourself. But there's a form of pollution going on in Osun State today. Like that factory very close to Ikirun, these recycling plants, and the one in Ife, that is mass death for a lot of people. By now, this heavy smoke coming out of those factories have been percolating the soil, that around that area, you will have been seeing it in wells, in their water, everywhere. This lecture is really touching, very scary. And I want you to talk on that. There was a time they were challenged. They said they have applied something to the smoke, that maybe they have removed the hazardous part of the smoke. And that's a lie. That is a lie. How do we go about this? When you mentioned the Ogoni cleanup, I remember that my hometown is Ikirun. That is more than Ogoni now. Death everywhere. Up to Ire, Inisha, Okuku, you see this substance in their wells. It is a waiting bomb. Please speak on that, sir. Thank you very much.
I think Prof has a very big task before him this afternoon.
Prof, thank you. There is a public perception and fear in the public about the telecommunication mast. People believe the radiation from the mast can cause cancer. I am a public health officer. That has been the issue in the public. What is the relationship between the telecommunication mast and cancer? There have been instances where the diesel that they use for operating this generating set from the mast has been found in the well. And the heat generation, the noise, and sort of things, and mostly this time around, the masts are very close to residential buildings. Is there any correlation? Is there any interest in between the two? Is there any effect on human health?
3G, 4G, 5G. They say they are all conspiracy theories.
Good morning, it's still morning or afternoon. Prof, thank you for a lovely presentation. Some of the things I wanted to raise, I'm Daniel from Nezra. Dr. Guinea has already highlighted them, but I just want Prof to also speak on grilling, that's using microwave, not necessarily to speak on grilling, using microwave, not necessarily using the conventional suya things and all that. So that's just the bit I want to add. Thank you.
Thank you. Prof, over to you.
Thank you very much. Number one, about incinerator, what happens to PVCs and other plastics, rubber and etc. I'm happy that you raised this point. No doubt, when we first talked about incinerator, it is releasing a lot of smoke. When you burn it, it releases smoke. But now the technology has changed. In the Renewable Resources Center in UI, where we developed, smoke comes, but we don't allow the smoke to get out. The smoke is passed through some condensers, and we are now converting that into biodiesel. That means it is condensed and then comes down as liquid or gas. We store it, and then we put on the generator to run it. You can see that. That technology is now popular. Don't allow the smoke to get out. Condense it. Convert that into biofuel. Use it to operate your generator, or you can even cook your food. In fact, very soon we want to also introduce, you can even run our Okada or tricycles or even cars. That technology is available. If we use that, no problem. In fact, we use this technology in one of the communities. We have a lot of these PET bottles, plastic, nylon, all these. We've installed one unit which is costing about 1 to 1.5 million. We borrowed some money from somewhere. But the community is now enjoying. They're producing electricity, and that electricity they are using to charge your phones in the community where there is no light. So that kind of things we should try. That is a very important problem we have to forget. Also keep in mind, Ministry of Environment says all the biomedical waste has to be incinerated. Only in Nigeria people are saying incinerate. But when you go to New Zealand, Australia and other countries, they are now saying no burn technology. They don't want to see burning. How do you compromise? One day or other, the burning technology must move. Because burning is releasing a lot of pollutants which are carcinogenic. Okay? So here now, our biofuel, what we are preparing, is a good example, and we should encourage that kind of technology. Now radiation. Second question is on radiation. Low level is safe, no doubt, yes. But we can't avoid, we can't escape from that. What I am trying to say, avoid unnecessary exposure to X-ray. It's not a blanket. You go to admission or something, get your X-ray, get your X-ray. Or if you complain of pain of the leg, get your X-ray. If you have tooth pain, get your X-ray. That kind of undue encouragement of more X-rays, that is dangerous. So judiciously X-rays are important. We need, but be careful. Then we have the tobacco benefits, no smoking. The tobacco is addictive. Everybody knows tobacco is bad. Everybody knows the drug abuse is bad. But still we go for that because we're addicted. That is where we need to put on more and more of educating the people and then telling them the evils of it and slowly let them reduce. You cannot stop totally one day. Take your time to educate them again and again, reduce it. A typical example, for example, in the auditorium, in a theater like this, you are not supposed to smoke. And when you go to a theater outside in the city, nobody is smoking inside. Aircraft, when you are traveling, they say no smoking. And I don't see anybody smoking. So slowly that kind of habit will come up once you impart regularly. If you are educating the people to change their attitude is a slow process. You cannot achieve it overnight. But you have to keep on trying. One day or other to stop. In fact, public smoking has reduced a lot. Even if you are trying to smoke, your people among themselves will come and say, stop it, throw it. So people should take command of this and they should encourage them not to do this. Number 3, roasted food. We are not saying that we should not eat roasted food. Actually, we cannot do that. We need, but then be judicious. And again, when these women who are roasting it on the roadside or who are making suya, provide them a kind of structure wherein the fumes and the flames and the smoke, they go out. We are not doing that, we are exposed. As I see in the slide, children are around, woman is roasting, hot sun, all these are around. I think that kind of technology we need to change. Let them develop simple structures where the smoke is not around. That kind of things we can do it. We can encourage that. And if you do that, moderate use of this technology, it can help us. Okay, then some of this air pollution doesn't remain as air pollution. Whatever you are throwing into the air, it will come down to the soil, percolate into the soil, go into the water, so groundwater is polluted. That is where now we need to adopt appropriate management tactics. Smoke, you should not allow it to go, but you manage it by some other means. That is why now when you look at Nestle guidelines, when you go to an industry, they'll say, your chimney is only 6 feet high, increase it. Why do they increase? Because the more it goes up, it is going away from human beings. So like that, some of the regulations specified in the Nestle guidelines, we have to implement, make sure that people follow. It is not merely penalty, but they should also learn to change their behavior, attitude. And the industries themselves, they should know that, no, I want to improve. That kind of thing we need to develop. Then masks. Masks, there is a lot of controversial data on that. Many people complain that it has radiation, but there is no evidence. But in India, in my own town, what they are now doing in the city, Hyderabad, any residential area, if they are putting a mask, the residents are opposing. They will not allow them to install that. But recently I went there. There is a mask. As a result of the mask, the prices of the property has gone down. That is where now people are reacting that, please don't bring your mask here, because our property rate will go down. So that kind of reaction from the community, it will help a lot. We need to encourage, don't do it in a crowded area. Do it in a faraway place is okay. But still I can assure you, there is no proper evidence. Evidence is very slow trickling, not totally confirmed. Then we have the grills, microwaves. Microwave technology is modern. A lot of reports are coming that if you use your microwave, your health will go down, you will get cancers and all these are there. But in the modern society, you can't do away with that. Like for example, if you want to make quick coffee for 1 minute, 2 minutes, the microwave is more handy. Otherwise you are putting on the gas or putting on the electricity, it takes a lot of time. And you have to rush. And suppose you are going to the office, you want to warm up your food. Microwave is more convenient. So this is where you have to judiciously use this kind of technology. Don't totally avoid it. At the same time, don't become the slave to that equipment. So that is where we need to control. Thank you.
Thank you very much, sir. Before you go and sit down, we have two questions from people who are online. The first one, what are the alternatives to eating fish and chicken? Is egg relatively safe? Thank you for the wonderful presentation. And then, how can we protect ourselves from the massive air pollution in our environment? How do we protect ourselves? How do we prevent cancer?
About the fish and egg. See, our technologies have changed. The way you are now growing fish and growing chicken, you are using a lot of unwanted chemicals, hormones, drugs. So best thing is we have to